thought, well, gee, that's the end. I'm not going to make it. And I devoted my time to, shutting down the business, to all the things that would need to be done in tidying up my affairs.
Well, my initial reaction sitting in the doctor's office was just complete devastation. It was just the loss of the man I love, the father of my children, the man that I was going to spend the rest of my life with. You know, all our dreams were shattered. It was, my husband would miss out on sharing all the milestones with our boys, leaving school, their jobs, their successes in life, the things that we'd worked hard for.
I was urging my wife not to grieve too much and hopefully to meet somebody who's really nice, but above all who'd be good to my children. In early 2014, a secondary was found, and of course that resulted in a recommendation to go to the Mater to see Jared.
Hugh had a relatively recently recognised variant of cancer where it seems to be sort of an intermediate step between limited to the prostate and having gone widespread throughout the body. It appeared that he had 2 lesions that had gone to his bones, one to a rib and one to the spine. It was felt appropriate to offer Hugh a very focused type of radiotherapy called stereotactic treatment to try to ablate the disease in those 2 locations. So we had Hugh in and did a very sophisticated treatment delivery approach where we ended up binding together MRI scans, PET scans, a CAT scan, customising a very focused way of intensely treating both of those lesions whilst at the same time trying to do it safely.
We have a new technology called gallium-68 PSMA study. PSMA is prostate-specific membrane antigen. So the whole idea is that we can be more specific and more certain that these lesions are from prostate cancer because they have this specific label that's not found on other normal cell tissue or other forms of malignancy. So our hope is that within the next 18 months it may be introduced into the mainstream and more readily available.
Hugh came in for 3 visits of treatment to each of those areas. Each visit took about half an hour. His PSA pretty much immediately after treatment came down from a high level down to less than 1, and it is a state absolutely flatlined at that level right throughout 2015. So at the moment we're really considering Hugh to be in remission, and to be able to achieve that without any hormone therapy or chemotherapy or really any significant side effects is a real joy for us to be able to see.
Thank you. Thank you for giving me my husband. Thank you from my children to giving me their father back. Thank you for every day turning up to work and being determined to find a solution to this problem.
There couldn't be a better cause than to give people back their life. Like this. Fantastic. It's a whole family that has benefited. Yeah. Thank you. Thank you, everybody. Thank you to everybody.